Okay, I'm back. Sorry about that. I don't know what happened with the connection. So, as I was saying, today's appointment is specifically focused on a topic that often comes up in the stories shared by family members, and that is the management and care of a family member with a diagnosis of dementia or Alzheimer's at a very particular moment in their life and day, which is related to hygiene. What does that mean? It means that clearly maintaining personal hygiene, it's a condition of greater cleanliness of one's body, falls back into what is considered normal. But unfortunately, as we know, in a disease like dementia, often the normality becomes something very difficult to achieve. Family members who come to the association when they ask us, normality becomes something very difficult to achieve. Family members who come to the association when they ask us this problem, the question is very straightforward. It's very simple. My husband doesn't want to be washed. My husband is no longer able to wash himself. He doesn't want to be helped. What should I do? How should I behave? Before we get started, let's take a moment to go over some general guidelines, even if they are just broad strategies we can use in this case. Clearly, we need to make a small introduction about how a person suffering from Alzheimer's functions and understanding that refusal, the difficulty in washing oneself and taking care of one's personal hygiene does not depend and does not stem, just like everything else, from an intention, but rather from a great difficulty in being able to, let's say, even just processing in one's mind what the steps are. Why? Because clearly for us who do not have a disorder like this and who are therefore cognitively functioning, brushing your teeth is something immediate. It's almost taken for granted. I apologize. They tell me that it's not very clear. So I'm trying to put the headphones back on for a moment. Excuse me. Forgive me. Here I am. So today is a live session. A bit special. Sorry, I was saying. Clearly, brushing your teeth becomes for us a very immediate action. An action that may seem very simple on the surface. But for our brain, it's a very, very complex cognitive task. Because he has to put together a whole series of information that then leads to the execution of the behavior. This, clearly, in a person suffering from dementia, is very limited and very difficult. In all of this, as I mentioned earlier, we need to consider the fact that often when we are in a phase where the person with this illness is no longer able to take care of their own personal hygiene, their oral hygiene, their intimate hygiene, it means that the disease is already at a stage, I don't want to say very advanced, but still at an advanced stage. And so clearly, yes, other difficulties arise which are related, for example, to recognizing the object and understanding how that object works. I'll go back to the example I mentioned earlier about brushing your teeth. Probably, in my case, he is still able to brush his teeth, but maybe he can't recognize that the object, that element, with a harder part, longer with small little spatulas on top, is the toothbrush. And so that's what you need to be able to brush your teeth. It can happen, for example, to find persons suffering from dementia in the bathroom brushing their teeth. And when we observe what they are doing, we find them, I try to do it with a comb or a brush or with my finger. Why is that? Because, as I mentioned earlier, there is a great difficulty in putting together and recognizing what the object is and how that object works. On the other side, there's another element that is very important, which is disinterest. A person with dementia might lose interest in taking care of their personal hygiene. And it's very clear that talking about it among ourselves might seem like a trivial matter, but it's not a trivial matter. Why? Because he might not remember that he didn't wash this morning, or he might think, on the contrary, that he took a shower this morning, when in reality he took a shower a week ago. It could also to be afraid. Here, this is a very important word that I'm throwing out there, and then maybe little by little we'll take it together. He might be afraid of a moment that seems like just a moment to us, sometimes even a very relaxing moment like a bath or a shower. He might be afraid of a moment that seems like just a moment to us, sometimes even a very relaxing moment like a bath or a shower. For a person with this illness, it can be a source of very strong emotions like fear, like terror, and on the other side, agitation. This because I'll give you an example. I'll make a small parallel. Let's think about children. It's clear. I always say this, and I apologize when I make this comparison. But unfortunately, the functioning of a person with dementia, especially in an advanced stage, is very similar to that of children, with a big emotional difference on our part as family members, for which we, in the child, try to teach things because this child will acquire new skills. The person with dementia, on the other hand, unfortunately, we have to simplify the way we interact with him or her because sadly, they are losing skills. But here, to get back to what I was saying, when preparing the baby's bath, we have a whole series of precautions. For example, making sure that the bathroom is warm, making sure that the water isn't too hot or too cold. It's us who test in some way that the water is at a more or less right temperature, then we try it out slowly on the baby. We use a whole range of products. Let's make sure that maybe there are more toys. I'll give some examples. So, some of these things I've mentioned should also be used when we go to prepare the room, for example, the bathroom for a person with dementia. Prepare. Room. For example, the bathroom for a person with dementia. Other things, on the other hand, it's better not to take into consideration. So, I'm reminded of Illa, a lady who indeed brought this problem. The husband didn't allow her or give him a bath. I apologize. And on the other hand, he wasn't able to take care of his personal hygiene independently. Here, the thing we've worked on together is really about gaining a comprehensive understanding of how to prepare for bath time and collaboratively. I see that there are some people connected live. Like last time, if you have any questions, feel free to write them down or send them on the reference cell phone, which is, I'll repeat, the number 329-7674-316. That way we can also have a more constructive interaction for me to give a bit more specific information. So I was saying we worked on how to organize the room as well. Organize the bathroom so that the husband could be more cooperative. It was difficult. It was very difficult. Being able to make people understand that they have to go somehow. Lighten up the room, because I'm telling you to lighten up the room. Because the bathroom, just like it is in every home, with the mirror maybe, the rug, with the shower, with the bathtub, with all the products displayed, with the sink, the toothpaste, the toothbrush, the hairbrush, all the towels, maybe even the bathrobe. Forgive me if I'm making a repetition, let's say, a list of items, but it's done intentionally. A repetition, let's say, a list of items, but it's done intentionally. Clearly, it's a bathroom for us. It's done intentionally. Clearly, it's a bathroom for us. Functional. We have everything within reach. We have the shampoo, the conditioner, the bubble bath, maybe the body cream, the depilatory cream, everything that we find inside a room where we need to take care of our hygiene, our personal care. All of this can potentially be a source of confusion for a person with dementia. Having too many products, the shampoo, the bubble bath, and the shower gel creates confusion. Why is that? Because maybe that person at that moment is no longer able to understand and recognize that shampoo is meant to be used for the hair, that you put the shampoo on first and then the conditioner, while the bubble bath is used for the body. And maybe we can find this person washing their hair with the body wash. Sure, it's not a problem. I mean, it's not something that it hurts. It can also happen to us that we don't have shampoo within reach and we wash our hair with body wash. For once, nothing happens. But what we need to focus on, please take into account, I apologize, that we must pay attention to its potential degree of agitation that this whole situation creates in a person with a pathology such as dementia. Why? Because I get confused, because I find myself in front of these products, I find myself in front of these bottles where something is written. Maybe I can still read, okay, I read that it says shampoo, I read that it says conditioner, but I can't remember. What do you use to wash your hair? I can't remember what the right order is to do this kind of action. And so the risk I run is getting agitated, and getting agitated at a moment that is potentially dangerous. Because maybe the person is wet. The person is inside the shower standing, maybe they are alone. And here we also open a parenthesis that we will look at. Then, soon, what is the maintenance of autonomy for as long as possible? When it is possible, it is clearly having an eye for what is a very important thing, in my opinion, which is the dignity of the person. So going back, taking a step back, it's clear that having a whole series of elements that are functional for the achievement of the goal, which is personal hygiene, can risk being, if we don't read our loved one's story well, if we don't understand the moment of our family member's illness well, they can become a possible obstacle. Another aspect, for example, to take into consideration is the temperature of the water. As I was saying earlier, when we prepare a bath for a child, we test to see if the water is warm enough. The water is either hot or cold. Clearly, this is what let's do it with ourselves too. However, we need to consider one thing, unfortunately, dementia. Among the various symptoms it brings with it, there is the element of misperception. What does it mean? It means that the person suffering from this illness perceives things differently, not just from a visual standpoint. And here I connect, for example, with what will also be some subsequent meetings. The hallucinations, so there is a visual misperception, and I'll open a parenthesis. For example, the mirror in the bathroom. It can be an object that creates a visual misperception of a hallucinatory type. And so this can be, for example, a reason why the person doesn't want to take a bath, doesn't want to go into the bathroom to wash, doesn't want to go into the bathroom to wash because they're scared, because it creates that sense of fear that makes me not want to go in there. Why don't you go in there, Dad? What's wrong with the bathroom? Come on, let's wash up. See, it's warm, we've turned on the water, it's all perfect. I'm not going in there. I'll give some examples too. Picking up a bit from the meetings I have with the families in the association where many insights come out. I think they are very important because they address reality beyond the more theoretical aspects. Here, this is an important element that I have to be honest about. Before working in this association, before working with the families of people affected by this illness, I hadn't thought at all about what my training moment was regarding these aspects. I don't go into the bathroom because I'm scared. Why are you scared, Dad? Because there's an old man looking at me. I don't know if it reminds you of something, but who is this man, old Dad? It's that one, and he points to maybe his reflection in the mirror. It reminds you of something. But who is this old man, Dad? It's that one, and he might be pointing to his reflection in the mirror. Why does this happen? And here I do a bit of movement, back and forth, also in the context of explaining the symptoms. This happens because, unfortunately, of the disease, Alzheimer's, but those who are following me know, unfortunately, better than I do. It takes the person who suffers from it on a journey back in time, okay? So recent information is erased. Recent memories are erased, and within those recent memories are the grandchildren. The children come back, the wife comes back. But why is this? Not because those people are intentionally erased from our loved one. But unfortunately, the disease, as I often say, without wanting to romanticize it, takes you on a journey back in time to the sick person. And so it might take my dad, who is 90 years old and suffers from dementia, to live in a much earlier period of his life, when he was maybe 20 years old. So it's clear that looking at his reflection in the mirror, he can't recognize that image. Why? Because in his mind, and therefore in his perception even of himself, he has the image of a young 20-year-old. So why did I make this digression? Just because there are practical aspects that need to be taken into account when we manage. Another practical aspect is personal hygiene. As I was saying earlier, we were talking about water, about the temperature of the water, especially when taking a shower. Often family members tell me this: we go to get in the shower, I turn on the water and he gets scared. Here, I'll give an example, and I ask the people who are with me today to work together with me. Even at the level of sensation, at the level of perceptions, it often happens to me, I have to be honest, that I get into the shower. Maybe I didn't turn on the water beforehand, or I did turn on the water first. I checked that the temperature was right for me, and then I step into the shower and get hit by the water spray. It makes even more sense if we imagine ourselves in the shower. We turn on the water. We're in the shower. We already turn on the water. Here I am again. I apologize. There was a problem maybe with the connection. We're in the shower. As I was saying, we turn the water back on, and we immediately find that spray of water hitting us. Well, I admit, honestly, every now and then I find myself making a movement, a little bit, let's say, but too much all at once. Clearly, I have a health condition. Okay, there was a question. Then I read, I definitely have a health condition of cognitive functioning that allows me to say I move, or I turn off the water and turn it back on, or even just to say it's nothing, it's water. Now, this in a person with dementia can be a reason for fear. Why? Because that spray of water is perceived as much stronger, perhaps more than it actually is, just like the temperature. I was just reading about a lady who writes, "My mom is always cold. The water spray scares her." Exactly. The misperception of temperature, Mrs. Marie. It is a misperception that we see, that we can observe both in relation to water, but also, for example, in relation to the outside temperature. How many times has it happened to have a family member with dementia that, despite it being cold outside, despite it being hot outside, asks to be dressed more or less appropriately for the outside temperature? The same goes for the water spray. Appropriately for the outside temperature. The same goes for the water spray. So it could be maybe a possible functional strategy, a possible solution. I use the word possible because I want to emphasize this. Otherwise, sometimes it seems like giving instructions that are not entirely functional, effective, or beneficial. It could be a possible strategy to let my family member touch the water. I was giving the example, earlier of the 90-year-old dad. Dad, feel the water, it's okay. It's warm enough. It's cold. How does it feel to you? It is clear that if the water is frozen and they perceive it as warm, I'm not saying to take a shower with freezing water. Okay. But it's also true that we need to try, and this is always the case with the illness. We need to try to find a middle ground. A negotiation between what is, the reality, my objective reality is what it is, I apologize, the reality of the sick person. So if that water is okay for him, then maybe we can use this moment as a way to get closer to taking a shower. And then at the moment when he or she, I apologize for using the masculine, but he or she is in the shower, try slowly to adjust the knob, the water temperature, so that we have a water temperature that's more suitable for a moment like taking a shower. So these are little techniques and tricks, they are small strategies that can be effective and helpful. In the same way, for example, if there's a bathtub, the bathtub is almost always associated with the idea of relaxation I'm going to take a bath to relax. I'll go in the tub. I'll stay there for about an hour. That way I can unwind and rest. For a person with dementia, perceiving that level of water, having that water in the tub can be a source of fear. Why? Because they don't perceive the depth very well. And here we return to a symptomatology that often accompanies the illness, which is indeed visual misperception. We often advise family members, if at home there's a light-colored floor with maybe dark rug on top, it's likely that a loved one may have difficulty encountering this rug, so they might either freeze up, getting scared, or trying to take a step up. Why is that? Because maybe that color contrast between the floor and the rug can be perceived either as a hole, and so there I get scared because I don't want to step into a hole or like a step. Here, this same visual misperception. It can happen at the moment, for example, during a bath, because the water can be perceived as higher or lower, and so it comes back once again. It goes back to this fear, drowning, getting hurt, not fitting in the tub, even there using small precautions, like when taking a bath. The fear of not being able to fit in this tub. So even there, maybe using some small precautions, like for example, we want to take a bath. Okay, but maybe let's put a bench so that the person can sit and have part of their body out of the water. So there isn't the fear of not being able to handle this height of the water. The other aspect, and it's perhaps the most important one in my opinion, is an aspect that is very much connected to the dimension of privacy and the dignity of the person. What does it mean? Often when I talk to family members, this dimension comes up, this dimension here. These words come out. It's a bit difficult. But why? Because clearly, when we reach a certain point, we all face what is an objective necessity. This person needs to wash. This person can't go without taking a shower for 10 days. Why? Because it stinks. I apologize if I use such a strong word, but I'm quoting the words of the family members. Because they're dirty. Because maybe they haven't used the bidet in a week. However, on the other hand, we need to consider one thing. First, this person might not remember that it's been a week since they last took a shower. Second thing, well, I could be really embarrassed to have you wash me. I could be embarrassed to have my wife wash me. I could be embarrassed to have my husband wash me. I could be embarrassed to have my daughter or my son wash me. Is it true that there are family relationships? It's true that it might seem almost hard to imagine something like that. Let's always keep in mind that we're talking... Fortunately, in most cases, we're talking about older people. So they also carry a cultural legacy regarding nudity, intimacy, and the body being different compared to what our attitude might be. Even though I am your wife, even though you are my husband, it doesn't mean that I feel at ease in having me touched, in having me washed, in having me managed in what is a very intimate, very private act. Like, for instance, the moment of hygiene. On the other hand, and it goes back to the other side, I might not recognize you. I might not recognize you as my wife. I might not recognize you as my daughter. And so, at the moment you try to get close to me, I don't want you to touch me, I don't want you to wash me, but who are you? You're a stranger. I am a stranger. Don't do it. This is what, for example, I sometimes teach to the operators. When I train the operators, I always try to make them understand this aspect because it often comes up from the operators, just as it also comes from you family members. The fact that there can also be some aggression. I was saying, I don't know if you've lost me because there are some connection issues, and I apologize for that. I was saying there can often be an aggressive reaction. It's very common for family members to share stories just like the operators do. I got closer to wash him, I got closer to dress him, and he got angry. He punched me, he pulled me, he shoved me. See, this once again is not intentional. It's not aggression, it's not intentional violence that this person is directing against us because we are bad or because he or she is bad. But it's an aggression driven by fear. It's an aggression driven by the fact that I don't know you, as I said before, so I don't want to be touched by you. I don't want you to wash me. And we have to take this into consideration. It's clear that we are dealing with a person who has cognitive difficulties. During training session with some operators, it came up a bit. This question came from an operator who was saying that clearly all the people who find themselves in a state of poverty have to endure, in quotes, the care of one's personal hygiene by another person, whether it's a family member or an operator. Sure, that's very true, but this is also true. If I'm doing well, what does that mean? I'm fine, cognitively intact, self-aware, know my identity, age, year, no dementia diagnosis, may be unable to maintain hygiene. I can live with embarrassment and difficulty. Self-aware, know my identity, age, year, no dementia diagnosis, may be unable to maintain hygiene. It's clear that I can live with embarrassment. It's clear that I can live with difficulty. The fact that especially my hygiene, but at the same time, I have the ability to understand that this person is an operator or a family member who is there doing something for me and with me. If I am a person with dementia, I can't think this way. So for me, you are a stranger who is looking for the phone. If there are any questions also here, they are somehow trying to take my place. But I don't want to. I don't know you, I don't want you to do it, I can do it myself. Calmly, and above all, indeed, I repeat, I must say, I continue on that point, you. To me, you are truly nobody, so you are actually a stranger who is coming in. The more emotional aspect also comes into play. So, my father rejects me, my mother rejects me, my wife or husband rejects me, and above all, I have to stay. And even in this situation, and I also have to endure the fact that they do it violently. But what should guide us is what I mentioned earlier, that is, to understand that what they do is driven by their great fear, by their significant difficulty. So, in this case, one strategy we can use is a kind of preparation strategy. So, Dad is going to take a shower. Come on, let's go see if the bathroom is ready. Is this okay for you? Or should we put the bathrobe here? I'll help you. Do you want me to help you? If any of you were in direct contact, you would tell me it would be like this. I mean, if it were that simple. It's not enough because he still gets angry. And anyway, he attacks me. Sure, but we need greater collaboration. The issue is, let's go back to what I was saying earlier. Let's try to simplify the environment as much as possible. Now, it becomes difficult for a family member. The connection doesn't help us, I'm very sorry. Really, being able to simplify the environment, facing this moment, can be very helpful. So, the family member's struggle is to reach a certain point and say, I am a person who uses 3,000 products. Well, maybe it's best if there's only one product in the shower, like a shower gel, a product that can be used for all body hygiene. This is because of what I was telling you. First, to ensure that the person can maintain, for as long as possible, their autonomy, their self-sufficiency in taking care of themselves, as long as it's feasible. Their own autonomy, their own self-sufficiency in taking care of themselves, in being able to take care of themselves, in being able to do it, maybe not in the perfect way, but to be able to do it independently, still feeling in control of their own life, their own functionality, their own hygiene. However, you eventually reach later stages where this may not be possible. where we need to make different reflections. What does it mean? We need to make different reflections. Clearly, we need to operate with the idea of having a person who is clean, but not for follow me, not for what is the most socially acceptable dimension, but for one's own. Hygiene condition to prevent infections, to avoid complications even at a medical level. Here, this can lead to and mean having to reorganize this moment, for example, by using something different than the shower. You reach a stage of the illness where perhaps the hygiene of our loved one is ensured by using wipes, for example, baby wipes, or doesn't want to wash their hair, so we can use dry shampoo. Maybe we can still get them to take a shower from the neck down, but thinking about showering together with shampoo becomes difficult. Because, as we mentioned earlier, even with Mrs. Marie, the water spray is scary. Everything together is scary because, well, this is very important. It's a bit like what I was telling you earlier about brushing teeth. An action, something that for us has a value of relaxation for a person with dementia. It can be very stressful, it can be very tiring. So maybe we realize that today we can give them a shower so we can ensure cleanliness, body hygiene. Maybe we can wash their hair tomorrow. I mean, we need to do a job. I apologize for gesturing in front of the camera. We also need to do a compensatory job. We also need to do a mediation job between what are the objective needs and what is the maximum sustainable for my family member. Here, all of this clashes with the experiences of the healthy family member. Maximum sustainable for my family member. Here, all of this clashes with the experiences of the healthy family member. I can't stand that my husband doesn't wash himself because he was a very attentive man. Very clean. He would get dressed every morning as if he were going to work. In reality, he was retired. He would shave every morning. For me, it's unacceptable that he is in these conditions. Here is the work intervention on the family member, where alongside all these strategies, which can be more or less functional and effective, there must be work with the family member, also from a perspective of acceptance. I don't know, those who know me know that I don't really like this word of taking, of awareness. I become aware of the fact that unfortunately, once again, as long as my husband is still there, and so he has every right to be treated with care, to be treated with attention, to still be seen for who he is, that is a person, but at the same time, all of this confronts me with the fact that my husband is no longer my husband, that my wife is no longer my wife. And so we need to work on ourselves as family members, caregivers, of integration into our daily life, to our normality, in our experience of the fact that maybe it can take 10 days before I can manage to take a shower. To my dear, I have to try to find different strategies that can at least ensure a condition of sustainable hygiene. Here I also want to open up a parenthesis that might sound strange to hear, but I ask you to understand the meaning with which I say it. Sometimes it can be much more functional to find another person who can take care of these aspects. Why? Just for what I was telling you before. Often family members tell me, but a stranger, a nurse, a caregiver, they can take better care of my husband, my wife, my mom, whoever it is, right? Well, my answer is always a maybe. Why maybe? Because clearly from an emotional point of view, it's not the same thing. Clearly the love and care I can have for my mom, for my dad, cannot be the same. They shouldn't be the same. They shouldn't be even remotely the same for my mom, for my dad. They can't be the same. They shouldn't be the same. They shouldn't be even remotely the same. Messy in comparison with the emotional aspect of a caregiver. But this becomes a limit from a certain point of view. Because maybe, as I was saying before, my father can feel embarrassed at the idea that it's me, even if he no longer recognizes me as his daughter. But from an emotional point of view, does he feel that I am someone he is connected to? Of course, he might feel embarrassed to be washed by me, but on the other hand, I might feel embarrassed washing my dad. Because this is an aspect that is always considered as secondary. But instead, it should be taken into consideration and shouldn't be seen as not wanting to care for your loved one. There are those who can overcome this hurdle, and there are those who don't have this problem. But there might be family situations where there can be some embarrassment. And I force myself, despite my embarrassment, to take care of my dad's personal hygiene. Well, I can assure you that I risk not being adequate. And I risk passing on to my dad from an emotional and affectionate point of view this sense of inadequacy. Maybe I'm anxious, maybe I'm nervous, maybe I'm embarrassed, and this is noticeable. I always say one thing, unfortunately, dementia slowly takes away, piece by piece, every ability of our family member. However, the last thing that clearly goes away without remaining is the emotional part in a natural way. But the last element that is lost is precisely the emotional part. And it's an emotional part that remains in even their very childlike way. A child cries because they're angry, maybe they slap you. So, let's go back to aggression. The child slaps you because they're angry. It's clear I yell at you because I need to make you understand that this is not okay, but you didn't mean to slap me because you know that a slap hurts. Did you react in any way? You acted physically on what is your emotional state of agitation, anxiety, distress. On the other hand, the same thing happens in a person affected by dementia. But I always give this example. If I'm anxious, if I'm tired, if I'm nervous, and I try to rock a baby, me as a mom, me as a dad, me as an uncle, me as an adult, okay. Whether male or female, I try to rock a baby because they need to sleep. Well, I assure you, and you will assure me, that this baby will never sleep. Why? Because they sense my agitation. There is an emotional transmission. There is an emotional sharing at a very ancestral level, at a very physical level. So, the same thing happens in a person with dementia. So if I approach this moment, which is the moment of hygiene, with a lot of agitation, with a lot of anxiety, maybe I've been there for 2 days thinking, oh my God, tomorrow I have to wash my dad. How can I do it? I can't even imagine it. I can't even think about it. Or I have to wash my mom. I'm using the father. Because maybe the feminine aspect can create more embarrassment when it comes to the hygiene of male intimacy, especially with a close male intimacy like that of one's own parent. And I assure you that this is perceived. So, going back to what I was saying earlier, an external caregiver can be better at providing care. Yes, for this reason, because at that emotional distance that allows them not to be affected by what is happening. Then, I repeat, as I always tell the caregivers, you shouldn't be distant from what's happening. Because otherwise, isn't it your job? I mean, there has to be attention to the other person. There has to be an emotional involvement with the other person. But there is that distance that protects. There is that distance that allows me to say something really terrible, but try to understand me, to carry out that task well. Or at least being able to carry it out despite the attacks, despite the insults. Well, because beyond the hits, there can be insults, there can be bad words, there can be blasphemies. And it's clear that as a caregiver, it also affects me to be called in a certain way. But I can maintain the distance of professionalism and understand that the person isn't doing it because they mean me harm. If I, as a daughter, if I, as a granddaughter, if I, as a wife, feel called in a certain way, probably the reaction is different. And so this can also influence a delicate moment like the moment of hygiene. Alongside the issue of hygiene, I would also like to make a small reference to a very important aspect, equally important, which is about clothing, about how one dresses. It often happens that family members tell us, she always wants to wear the same shirt, he always wants to wear the same pants, she always wants to wear the same skirt, but it's dirty. I tried to make her understand that she needs to wear something else because those need to be washed, but no, she doesn't want to, he doesn't want to, they always want to wear that stuff. This can be related to many things. Certainly, the first two that come to mind, which I feel I should mention because I believe they are also the two most important aspects. From a certain point of view, it's safety. How can I put it? It's a bit like Linus's blanket. That's my favorite shirt, that's my favorite skirt. I don't even know if that's my favorite shirt or my favorite skirt. But I want to wear that stuff because with that stuff on, I feel comfortable, I feel cozy, I feel protected, I feel safe. On the other hand, I feel comfortable, I feel cozy, I feel protected, I feel safe. On the other hand, it's a purely cognitive aspect. I laugh because I imagined it. Let's picture ourselves opening our closet full of stuff packed, overflowing with things. Well, it often happens to me to have so many things, to look at the closet and say, I don't know what to wear today. And I have all the pants there looking at me, all the shirts there looking at me, all the jackets there looking at me. I get confused because I have so many things, so many choices, so many possibilities for combinations, that in a moment when I might also be in a hurry, I don't have the ability to stop and think. I don't know if you're following me. On the other hand, I have the ability to say, okay, today I'm wearing jeans, putting on a black shirt, and I'm adding a red jacket on top. I'm just saying, the same thing happens to a person with dementia, with the difference that they don't have the ability to use a choice strategy. So when we put a person with dementia in front of a choice, Mom, do you want to wear the blue skirt or the black skirt? It's possible that I tell you or that I say, you decide. Or that they don't respond, that they say no, or maybe they say, I want that one. Mom, but that one's dirty. I want that one. Why do you want that one? Because I want that one. I want that one because I can no longer choose. I can no longer understand. I want the blue skirt, I want the black skirt, I like the blue skirt, I like the black skirt. And likewise with everything. The other clothing, that's why one piece of advice I often give is this. First of all, not in front of the person because it risks becoming a reason for distress. And clearly not in a immediate, but when we are in this phase of the illness, when we recognize that we are in this phase of the illness, we should lighten the wardrobe as much as possible, leaving behind clothing that might be more acceptable to our loved one, which should also have certain characteristics. A little more specific, like maybe preferring pants with an elastic waistband instead of a button. Why? Because the button can cause confusion once again. Let's think about ourselves when we have to button up a shirt that has a lot of buttons. It takes us a long time, we might get frustrated, especially because we can't immediately get the button through the hole. Here it is the I'm coming, sir. This feeling is even stronger in a person with dementia, so let's lighten the wardrobe, let's lighten the things they have. This is a bit of a continuation of what I was saying. First, unfortunately, the home where a person with dementia lives is a home that will gradually lose some elements over time. On the other hand, another piece of advice I often give, and which family members say is often effective, is this. Mom always wants to wear the same shirt and the same skirt. So let's buy 2 or 3 pairs of the same shirt and the same skirt so that when one is dirty, we can have her wear something that is clean, but something that makes her feel secure. One is dirty. We can have her wear something that is clean, but something that makes her feel secure. And so we don't put her in front of the agitation of having to choose something new. When they don't choose anymore, in your opinion, is that already an advanced stage? So, Mrs. Marie, it's difficult to determine what the stages of the disease are. Technically, we have an initial phase, an intermediate phase, and an advanced phase of the disease. Clearly, when it's missing the ability to choose, we are already in a stage of the disease where probably also what I mentioned earlier, the ability to understand, the ability to associate, has worsened, so it's less functional. So we are definitely in a phase where if we can avoid putting the person in front of the need to make a choice and therefore at risk of agitation, then we need to use compensatory strategies. I always give an example. I'm often told I ask her if she wants coffee at the end of the meal or if she wants coffee in the afternoon and she responds no or she doesn't say anything. But then if she sees me drinking it, she wants it. She doesn't say anything to me. But then if she sees me drinking it, she wants it. Why is that? Because maybe the questions like, Mom, do you want coffee? Or Mom, do you want coffee or do you want tea? It risks causing confusion because, for example, I am someone who really loves coffee. I've always drunk a lot of coffee and I know that the drink I like is coffee. But if I have dementia, maybe I still know that I want that drink, that hot drink, that black drink, that flavor. But if I have dementia, maybe the fact remains that I know that I want that drink, that hot drink, that black drink, that flavor. However, I can't remember that it's called coffee. Very good, she always responds. I don't know. Very good, exactly. Obviously, I don't know. It's a clear sign of what I was saying before, that I don't know what I want. I don't know if I want coffee or if I want tea. I just don't know. If I want the blue shirt or the black shirt, follow me. I know what I want. Well, when it comes to coffee or tea, it's easier for me. However, the example is also transferable to what we are talking about today. I know I want that hot black drink that makes me feel good when I drink it. I make a very silly reasoning. It makes me feel more energetic, but I don't know that it's called coffee. So the question, do you want coffee or do you want tea? I don't know. Or no. Because in reality, I would like something, but I don't know how to make you understand what. So one way could be to say no, because often family members bring this up. At that point, I choose everything for her or for him. Well, we reach a point in the illness where this happens, but we need to do it while being careful to make them feel included. How? I know you love coffee, so I say, Mom, let's have a nice coffee, but I've already prepared it. The coffee? I'll put it for you, I'll serve it for you, in such a way that it becomes also a moment of sharing. There's another question. How can I convince her to change her underwear daily? This is a very interesting question. Mr. Leonardo, that ties back to what we were saying earlier because maybe the person thinks they have already changed it. Do you think there's no need to change it? Maybe what we can do is change the underwear. And at the moment when there's a change, for example, from pajamas to a tracksuit or to a skirt or pants to regular clothing, more from daytime clothing to nighttime clothing or vice versa. What you can do is try to include again in the things to wear indeed the underwear or the bra, in the overall things to wear again, indeed the underwear or the bra. If a person is able to do it on their own, let's let them do it. Otherwise, what we can do is try to guide her. Mom, put on the shirt. Mom, put on the pants, put on the underwear. Another thing that can often be very effective and functional, especially in a couple's dynamic, we put on our pajamas at the same time, meaning we're getting ready for bed. If I have my loved one, my family member, put on their pajamas at 5, but I stay dressed in my daytime clothes. Well, the risk that might happen is that this person doesn't want to put on their pajamas, because as compromised as they might be, they can still make a comparison. Between you and me, it's like saying, but why do I have to wear this stuff while you still have your shirt on? So maybe it can be a strategy to wear pajamas together at the same time and act a bit like a mirror. I apologize, so maybe I'm putting on my pajama pants, so look. A strategy of putting on pajamas together at the same time and acting a bit like a mirror. I apologize, so maybe I'm putting on my pajama pants, so look. Let's put on the underwear, let's put on the pajama pants, let's put on the shirt. All right. Maybe this can help our family member to wear things more easily. Now, as I said before, don't take these strategies as absolutely foolproof to wear things more easily. Now, as I said before, don't take these strategies as absolutely foolproof. Often, I speak for myself, personally, it takes me a bit back. What is frustrating is not being able to provide the right strategy and the effective strategy. For everyone, however, there can be ways that, over time, with the right approach, with the repetition, with the right timing, they can also help us and make it easier for us in daily activities like managing hygiene or, as mentioned, managing clothing. Timing, they can also help us and make things easier in daily activities like managing hygiene or, as mentioned, managing clothing. I don't know if there are any other questions. If anyone has any questions, feel free to ask me. Another aspect I wanted to touch on for a moment. Before we say goodbye, let's go back to always keep in mind what our family member's routine was. What does our family member's routine mean? If this person... I'll be right there, I got lost because there was a moment of pause. What I was saying is that I'll do a brief recap. It's important to consider the routine, the habits that the person had before the illness. Yes, I know, I apologize, in fact, because the connection is a bit unstable. I apologize. I'm mortified, but at this point I'm probably not. Today it's not working well. I'm sorry because I'm in the studio and usually it works quite well here. Mrs. Marie was saying she rightly asked me about those that are the aspects related to hunger and appetite. If you go to our Facebook page of I'm a Florence as well as Casa Alzheimer, you'll find a meeting that took place in December 2024, right from me. A specific meeting about meals and nutrition where a whole series of guidelines are also provided. Let's have a chat about these aspects together. A chat on these aspects. Projects. From a practical point of view, also on how to organize and set the table, but also a little understanding of what the difficulties might be. And sometimes I make this small connection about whether to accept food or not. Also because we need to consider whether that food belongs to their eating habits or not. Okay. So, I repeat, I sincerely apologize for the terrible and very poor connection today. I hope I was anyway. Clear enough, and at least provided some guidance. As I mentioned at the beginning of this recording, you can write or comment under this post for anything, but also you can call our association. I'll give you the phone number, which is 055 433 187. That's the association's number, or 32 97 67 43 16. So here you go. You can contact us at these numbers without any problem to ask questions if you want to set up appointments with us at the association, understand a little better some aspects that may have come up during this meeting, just having a one-on-one meeting. All right. Thank you for being there. Really, despite the difficulties, it wasn't easy, but I thank you. And that's it. With that said, I say goodbye. As I mentioned at the beginning, today was a catch-up meeting for the one that was supposed to be yesterday. Starting next week, we'll resume the regular schedule, which is a meeting every Thursday. Of course, let me repeat the cell phone number 329-7674-316. Next week, we'll resume the regular schedule, which is a meeting every Thursday. Sure, I'll repeat the cell phone number 329-7674-316. All right. Thank you all, and I'll see you Thursday. On Thursday, there will be another colleague who will cover a new topic. But if anything, don't hesitate. We as AIMA are here. Good evening, everyone. Goodbye.